Welcome to the Orleans Parish Sheriff's Office Health and Wellness Fair. I'm here with Dr. Armando Hevia. Dr. Hevia, welcome, and thank you for joining us.
Thank you very much.
Could you please introduce yourself? Tell us a little bit about yourself, where you started, what you're doing now.
Absolutely. My name is Armando Hevia. I'm an emergency room physician works at East Jefferson and also at several of the Oshners. I've been doing emergency medicine for over 20 years, and it's a pleasure to be here. I'm honored to be here with you.
Good. Each year, the Orleans Parish Sheriff's Office holds a health and wellness fair. And at these fairs, we share a lot of information on different types of health, mental, physical, and financial. This year, we're working with the COVID-19, as you can imagine, and all of the restrictions that go with it. And everybody has a lot of questions about what's happening now and in the future. As an emergency medicine doctor, what can you tell me about COVID-19 right now?
Well, certainly as an emergency physician, we saw a huge number of people get infected in early March and April of 2020. That was definitely a difficult time in my career, seeing so many sick people and not knowing exactly what to do at that moment. Followed by waves of kind of high infections that came to the city later in the year and early this year. Luckily, at this moment, we are seeing a much lower infection rate and a much lower degree of COVID-related deaths. So that's always a great thing, but it's not zero. It's important at this point to remind everyone that the most important thing that we can do is to vaccinate. Vaccinate everyone in the community that is eligible, and that includes children that are 12 years of age and higher. And hopefully soon the FDA is getting close to finishing some of the research and getting the vaccine for even younger children. Currently, I know a lot of people have concerns about their kids and what to do, especially since they can't be vaccinated if they're less than 12. And the most important thing is to just be smart. If someone's sick, isolate. Wear a mask whenever appropriate, and try and keep as safe as possible. Nowadays, certainly if you are vaccinated, the CDC has recommended that you can kind of go back to regular life. Of course, that's always being smart. If someone is sick around you, you should probably go back to being masked. If someone is unvaccinated, encourage them to get vaccinated and to get us to close to herd immunity. In the future, it's unclear what's going to happen. We're not sure if we're going to need boosters or if there are going to be any variants of this virus, kind of like what happens with the flu every year. But hopefully, if we can get close to herd immunity or get almost everyone vaccinated, then we can certainly beat this thing.
Well, thanks, Dr. Hevia. Certainly, you said something about getting things back to normal. At the onset of the pandemic, people were encouraged not to touch their eyes, nose, and mouth, to wash their hands frequently. Are these things that you are still telling people to do?
Absolutely. These are things that common practices. That's one of the reasons why we have seen a very large decrease in the flu this year, because I think everyone is practicing good hygiene. If you're sick, you're staying home or definitely wearing a mask, even if it's another virus or something like that. Washing hands and general hygiene is always a good idea.
Yes, that's something that, of course, I practice, but I'm glad to see a lot more people practicing it now.
Awesome. Yes.
Throughout the pandemic, the Orleans Parish Sheriff's Office has stayed open. We are 100% vaccinated at our facility.
Awesome.
Closed. It's been a long couple of years for many employees. They've had to juggle childcare, school, family with work. What kind of stress do you see people showing? And what kind of things can people do to help them wind down or relax And are there any warning signs for when they need professional help?
Yes, certainly with COVID and everything changing in our lives, the stress has gone up. Having kids at home, working from home, everything has changed. The stress of just getting sick and not knowing what's going to happen definitely has increased everyone's stress level across the board. There are some things that you can look for as far as stress signs are concerned. If you start having basically difficulties kind of functioning the way that you were functioning before, that's one of the first signs to kind of look for. If you start having trouble with your sleep, if you start having kind of increased weight gain or even increased weight loss, if you start feeling isolated or withdrawing from people or feeling worthless, or those are signs that you could be starting to feel some signs of depression or stress. Increased anger or irritability, loss of any interest in things that used to excite you before, or even worrying about things obsessively over and over again. Turning to alcohol or other drugs, certainly not the best coping mechanism when it comes to that, and inability to concentrate. We see this in kids too, where stress certainly affects kids as well. But they kind of show stress in different ways, such as changes in their behavior. They get more aggressive, more moody, more clingy at times. They can develop more kind of signs and symptoms like nail biting or bedwetting. They can complain of more headaches or stomach aches. They get more scared about things, about fears of different things that they didn't have before, and can have more troubles at school or not want to go to school, depending on how the stress is. So those are some of the signs that we see in adults and kids. There are ways to cope with these signs of stress and kind of early depression. You can certainly work on balancing the work and home, kind of giving yourself a calmer situation both at work and at home. Exercising has always been shown to be helpful in these situations. Limiting any of the other kind of crutches such as alcohol or other stimulants or drugs is definitely important. That just kind of masks the underlying symptoms. Eating well, and making sure that you're eating and drinking water and stuff like that well. Connecting with people around you, asking for support with the people around you. Taking time to do things like your hobbies that you like to do is always helpful. You can try meditation or yoga. Those have also been shown to help. Sleeping is very important. Trying to get yourself on a regular sleep schedule. Pets, if you have a pet, they're always a great source of constant love. And if you can afford it, taking a vacation. If you do get to a point where things are starting to feel overwhelming, if you start having increased negative thoughts, increased ability to concentrate, increased ability to think positively about things, it may be time to seek professional help. At that time, you can contact your insurance or contact your primary care physician for a referral for possibly a psychiatrist or a counselor, or your primary care physician can sometimes help with just kind of early signs of depression.
And on that note, I know that a lot of people have, at least they're saying that a lot of people have found it difficult to take care of their own health during this COVID time. Are not going to their regular doctor's appointment. And everybody needs regular medical care. So what kind of regular medical care does everyone need at the minimum and maximum? What happens if you miss the regular health care for kids?
Yeah. It's important to establish yourself with a primary care physician that knows your case, and in kids, with a pediatrician that knows kind of if you have any medical issues. Even if you don't have any medical issues, it's always good to go see your primary care doctor at least once a year to get your regular screening, to check your cholesterol, other things. And as we get older, you start checking things like prostate and colon cancer and other health problems that are screened for, breast cancer as well. So it's always a good idea. And depending on kind of how many medical issues you have and how complicated things are, you may require more or less appointments with one or more doctors and specialists. As far as your kids are concerned, it is important to have a yearly checkup for your kids. This will help us kind of see if your child is reaching all their developmental milestones, make sure that they're getting all their immunizations that they would need, make sure that they're growing appropriately, and of course, screening for any other possible diseases like childhood diabetes or things like that that could be coming up. So it's always a good idea, even if you do miss an appointment or you miss a year like this last year, getting back on schedule and getting back to getting with your primary care is always important.
Most of the Orleans Parish Sheriff's Office employees have employer-based health care through United Healthcare. Sometimes it's a little hard to pick a doctor. Any tips on how you can pick a doctor? What kind do you need, or what do you need?
Yeah, this can be a bit frustrating navigating the insurance companies, but with United Healthcare, they should provide you a list of doctors that, like, especially with a primary care physician, that's the key, I believe. There should be a number on the back of your United Healthcare card that should help you to set up an appointment with a physician, or to give you some resources or numbers to call to set up with a primary care physician. From there, your primary care doctor can help you if you need specialists or something along those lines. But your United Healthcare should also provide you a list of specialists if you were to need something like that. So definitely finding a doctor, once you get established with one, they can help you with getting further care if you need that. So.
You should go for not for a specialist first, right? You should go for primary care or.
Yeah, a primary care doctor can take care of the majority of things. Once things start getting complicated, like if your diabetes is poorly controlled or your high blood pressure is poorly controlled, and your primary care doctor is running up against issues of not being able to control them, then is when you kind of move on to a specialist or something along those lines. But most simple normal things can be taken care of by a primary care doctor or screened for by a primary care doctor.
Sometimes, look, I'm not a big fan of all this stuff on the internet, but I know people who just say, "Oh, I read it on the internet; it must be true." I heard about this great diet on Facebook. Is it true? What are the real good sources for medical information that you can rely upon, that you rely upon?
Yeah, it's very difficult. My kids do the same thing. They go to a YouTube video and they think it's the gospel as far as that's concerned. So it's hard to tease out what information is real, what information is not real nowadays, especially with the social media and the internet kind of booming the way it is. I always go to kind of the national sources, like for things regarding COVID and the vaccine. The CDC is still probably the best place to go. So CDC.gov is a great source for that. As far as like for diet fads and things, a lot of these things are fads, but for a good resource for that, there's things like health.gov or nutrition.gov. And also if you have like some specific issues, like some specific medical issues, like the American Heart Association or the American Diabetes Association are always good resources to go look up. But usually these the national websites that kind of are vetted by physicians that are looking at all the research and all the data and trying to at least come up with an answer or one resource for everyone that has been looked at with true research and true and true data for all that.
So the American Heart Association,
the American Diabetes Association, health.gov, cdc.gov, and nutrition.gov. Those are all good websites when it comes to health and to nutrition.
We have a few questions that we got in our box.
Sure.
Questionnaire box up. The first question is I've been very stressed recently. What can I do to feel better?
I think we touched on this before, but the first key is to trying to set up a calm situation in your house and trying to reduce the stressors in your house and at work if possible. And then exercise, sleep, diet, those are all important things to do. But if you do feel like anxiety is getting overwhelming, like it's taking over your life, at that point, this is a time to go see your primary care physician. And you may or may not need a psychiatrist, but touching base with a primary care physician is probably the first step. If at any time you feel like it's getting overwhelming, you're feeling suicidal, or just you can't cope with what's going on, the emergency department is always open, and certainly we want you to call 911 or come to the emergency department if you were to feel overwhelmed or suicidal.
I know that a lot of people are reluctant to call a doctor, but a number of the healthcare insurance plans now have a hotline that you can call almost 24 hours a day. You can call a nurse, and a nurse can connect you even with a prescription if you need it. The other day, my daughter was starting to feel a little congested and wasn't sure, so she called up and they gave her a prescription for allergy.
Mm-hmm. Yeah, that's definitely true. That a lot of the insurance companies, and I'm sure United Healthcare has one as well, has a nursing hotline or an on-call hotline, and they're backed up by physicians and by protocols as far as that's concerned. And then they also have other resources like telemedicine is kind of really becoming more popular, where you can see a physician or a nurse practitioner or a physician assistant just here like we're doing right now on Zoom. And some of the more simpler cases can be taken care of by the telephone or by telemedicine. But certainly there are certain situations that are difficult to deal with over the phone, and that hotline can help to get you with your primary care doctor. They can call in a prescription or stuff like that, depending on what you need.
Yeah, Dr. Hevia, she actually did a video with herself and then emailed the video to the nurse and got her some medications right away. She's doing.
That's awesome. They're great. The technology is getting great. There are now even some little things where you can actually have little otoscopes to look in ears, and you can look into the back of the throat. You can take a video of it and you can send it to your doctor. You have ones that you can actually listen to your heart and listen to your lungs. You can just put the little device on your heart and on your lungs, and you can send the sounds to your doctor. So yeah, telemedicine is coming a long way, but always some sort of visit with a primary care doctor is the key.
Good, thank you. A few more questions. Here's the next one. My kids have been wild during the pandemic. What can I do?
Yeah, it's difficult. They have a lot of energy. I mean, the key is to try and get that energy out. I have to, with my son especially, we have to run him. It's kind of like a dog sometimes. It's like you just got to go bounce on the trampoline, go do this, go do that, and try and get their wiggles out, and then try and
sports.
Yeah, sports. Try and give them activities like art activities or things to do to keep them entertained at home. Sometimes it's easy to have, the babysitter television, but that I find for at least my son that they require movement to try and get some of that those wiggles out. So,
addiction is a real serious issue, and this question says that either I or a member of my family or friends seems to have an addiction problem or is developing one. What can they do to stop an addiction if they see it coming? Because most people don't see it coming.
It's just true. Yeah, it's a difficult question, and it does kind of creep in as far as addiction is concerned. At first, when you have a drink to kind of deal with your nerves or something like that, it doesn't seem like much, but then it becomes a problem if you're kind of constantly going to that as a way to deal with stress or anxiety. There are resources in the community as far as I think the key is still talking to your primary care doctor and seeing what can be done at that point, and then from there we can kind of work towards deciding if any kind of other more significant interventions needed. The big key is to if you do feel like your family member is in danger, such as they're suicidal or homicidal, you can go to the coroner's office and get an order of protective custody, and that will allow the police to come and to have your family member evaluated if you feel like things are getting to that point. But during times of sobriety, trying to get that person to to see their primary care doctor or a psychiatrist or a counselor, those are always the key to try and work on the underlying kind of stresses that are most likely causing the need to go to alcohol or drugs.
Thank you. Next one is, I always have to deal with difficult people. How do I deal with them without getting myself upset?
It's difficult. Everyone's stressed, and everyone is, does have some difficult people around them in their family or at work. The key is trying to stay calm, trying to realize that they're also stressed as well, and to have some compassion for them as well, that they're trying to do their best. Talking to them directly, discussing, how you feel, and trying to, if you need to, go to your bosses if need to. But trying to join with that person, kind of link with that person, and trying to make the situation better for you is always the key.
Always take a lot of deep breaths.
Yeah, deep breaths, calming breaths, meditation.
Oh, last question we have here. My children are not vaccinated. Should I worry that they can catch COVID, or should I vaccinate them?
Well, right now with the COVID vaccine, it's only children 12 years of age or older. So if your children are 12 years of age or older, please vaccinate. That's the biggest thing that we've seen has dropped the numbers of COVID-related cases significantly. Luckily, kids, are showing less symptoms, but still some kids are having symptoms. And they are getting sick, and some are dying. So it's important to try and get vaccinated once it's available for the younger kids. Unfortunately, kids can still catch COVID, but a lot of times are asymptomatic or show very few symptoms like the sniffles and stuff like that. Again, try and stay as safe as possible. Try and avoid anyone who might be having cold symptoms. If you're going into a situation where you feel like you're unsafe, or you feel like someone may be infected with COVID, wearing a mask especially for everyone in the family is not a bad thing, not a bad practice to do.
So young people can still wear a mask.
Young people can still wear a mask. I know the CDC has loosened some of their restrictions, but certainly if you feel like you're going in a situation where there could be some infection going on, or there's a large group of people together that you don't know, or that wearing a mask is not a bad thing. So I hope that answers that question.
I think it does. Dr. Hevia, I want to thank you so much for your time. We're going to collect all of the references and things that you said, as well as this video, and post it for everyone to see and hear. Thank you for joining us at the OPSO Health Fair. We really appreciate your time and everything that you told us today.
Awesome. Thank you very much. It's been my pleasure. Have a good day.
Thank you.